Hi, I'm Dan Lagani, the CEO and co-founder of Silver Solutions. Welcome to this week's edition of AgeWise. As a company on a regular basis, we're proud to help make the process of growing older safer, easier, and less stressful for families all across America through our safe living and home solutions. But with AgeWise, we expand our footprint to help you as a consumer simply become better informed about all the things you'll need to know to make growing older better and easier for you or your family. Today, we speak to Frank Lalli. Frank is one of the most accomplished investigative reporters and journalists in the business. He's currently the host of NPR's Robin Hood Radio's The Healthcare Detective. Frank's experience in the past also includes being the editor of Money Magazine, the editor-in-chief of George Magazine, where he and I first met almost 20 years ago. It's sort of amazing that much time has passed. You've probably seen Frank on the Today Show, on Nightline, on Good Morning America. Without any further ado, please join me in welcoming Frank Lalli to AgeWise.
Well, that's a very generous introduction. And as I say, at least once a day, I'm just a lowly reporter. That's all I've been my whole life. That's my career. I just try to ask the right questions and get the right answers, and I take notes.
Well, I'm excited to have you on today. We've got, because of your pretty broad set of experiences in healthcare specifically, so many different areas to cover, from how to navigate successfully through the world of large health insurance companies to your book, Your Best Healthcare Now. I'm looking forward to hearing some highlights out of that, as well as some of the current reporting you're doing at Robin Hood Radio's The Healthcare Detective on COVID-19, and specifically the impact that it's had on the senior community. So, Frank, let's start, though, with something a little more personal. You and your interest in healthcare, where did it come from?
Well, I got seriously sick after running a couple of magazines and essentially being in sort of semi-retirement and not thinking about writing a book. In fact, I got a blood cancer called multiple myeloma, and that forced me to take my reporting skills and apply it to healthcare to learn where to get the best advice, the kind of insurance I will need, and how to talk to the insurance companies to make sure I'm getting what I really need. You know, that was 12 years ago. I was diagnosed 12 years ago with a disease that in those days, people were dying within 2 or 3 years. So I was lucky in a lot of respects, but also as I took it one step at a time, I did have very good guidance from my doctors. We did work as a team together. I had access to specialists that anyone can get.
But let's talk about the financial piece of it, because as an outsider and sort of uninformed, thankfully, in many respects about the experiences that you personally had to go through, my sense is that getting coverage for the specialist is actually quite hard. That's not the case from what you're saying.
No, it's not hard. I mean, here's the problem. Insurance is expensive. So what's the bottom line advice? The bottom line advice is get the policy that gives you the broadest access to doctors without being out of network and getting hit with a lot of costs that way. Get the broadest possible access that you can afford. Traditional Medicare backed up with a supplemental plan for people over 65. That's my advice, even if you're really healthy, because you know what? You could pull out of the driveway and get hit by a car, and then you're not healthy anymore.
Well, yeah, and let's certainly hope that doesn't happen to either of us in the near term. We could have an entire conversation. We can have an entire conversation about Medicare, and hopefully we'll do that again in the future. But you started to give some really good advice, which leads very naturally into your book. Your book is called Your Best Healthcare Now. I think it's published by Simon & Schuster. Let's start with a little plug. Where can people get it?
Oh, anywhere, Amazon, it's available. Alibris, it's widely available. So it's a good book, and I say that proudly. Okay, it's a good book because it's different than other books, Dan. What I did was actually, I'm a reporter. I went out and talked to people who had all kinds of interactions with the healthcare system. They got sick, they bought insurance, everything that they did. Prescription drugs. I've got one chapter which is about 17 or 18 ways to save money on prescription drugs. It was all based on personal experience. I actually went out and said to people, what did you do? How did it work? What would you do differently? So the book is full of examples that you can learn from. It's not a dry medical book at all. It's filled with real reporting and the stories of real people. So there's an example in there of a cousin of mine actually who went for the lowest, cheapest insurance. And guess what? He got really ill, and then he got hit with a lot of bills. And one thing I wondered about: what can you tell somebody that is like the best advice you got writing a book? Here's the best advice I got writing that book: you can get a discount from your doctor. People said, "What? What are you talking about? That's impossible." No,
How do
it's
you
not.
do that? Tell us how you do it.
I can't afford that, doc. I know I need that medicine, or I know I need that treatment, but you know what? Here, look, let me show you. You have to be sincere. But if you say that, most doctors that I've talked to have policies in place to cut their bill in half. Okay. And in some cases, down to 20%. And in some cases, they do it for free.
I want to shift on to a different topic. And
Mhm.
it relates back to some recent reporting that you've been doing through the healthcare detective, and specifically around the coronavirus, COVID 19, and how it's impacted. We all know that it's impacted older adults just disproportionately, but there's something going on in nursing homes or skilled nursing facilities. Talk about what you've seen and what you've discovered there.
In this state, this is Connecticut, it has 1% of the population of the United States. It has 8% of the deaths from COVID 19 in nursing homes in this one state. Contrast that with a nursing home with no COVID of any of their residents. So I've talked to people on both sides. I've talked to people who are struggling to keep their nursing homes safe, and others where they were safe, that they continue to be safe. One of the major things they're doing is, the good ones are screening people at the door. So there's a nursing home down the block from us in the next town, Salisbury. Uh, they've got 90 beds. They've got 50 senior living. They have no residents with COVID, okay? But they've turned away 5 workers at the door. So the workers showed up early on. They were taking their temperature. Everyone had to wear a mask. Everyone had to wear a glove. Everybody was wearing a gown. They had proper PPE.
Let's go back to something again. Talk about the experiences that you went through with either your own parents or your in laws that may be helpful insights to get back to what we talked about, which was to make better informed, better decisions. What can you share about your own experiences there?
Yeah, no, I'm happy to talk about that. The bottom line is we needed help. We didn't know where to turn to get it. And if I had that experience again, I would do it very differently than we did it. So both of Carol's mother had dementia, really Alzheimer's at the end, and was very, very bad. It came on slowly. Okay. My father, at the end of the day, just went from nursing home into assisted living and then into a nursing home, and he died of a stroke. Um, they were both in Florida. So Carol's mother is the most instructive. At that point, we're in New York City. She's in Florida. We see her a couple of times a year, but we don't see her constantly. And we didn't pick up the clues that she was really starting to slip badly. We didn't have the help in the house that picked up the phone and told us, "Hey, you know what? Your mother is really having a tough time here. She's waking up at 3 o'clock in the morning and setting the table for 12 people, in the middle of the night, stuff like that." So we were slow to pick up on it. And then once she was in the nursing home and we had to go into her house, Dan, it was impossible. Uh, she had she had shopping bags all over all the closets and elsewhere. They were full of paper, okay, of one sort of Christmas cards from 7 years ago, along with a life insurance policy, bank account statements, along with notes that she got, when she was a teenager. We had to go through every one of those bags. I'm not sure to this day we got all of the bank accounts. because she had spread her money out little bit in all kinds of banks all over the city. We didn't know where to turn. Then she had a car. I asked another one of my relatives to actually sell the car, and he ended up essentially giving the car away. Somebody just double talked him, and he signed the papers, and that was that. It was mistakes like that, right and left, Dan, because we were out of state. We would go down, but for a limited amount of time, we had to go back to work. I wish I knew where to turn at that point. It would have been a lot less pain. And I'm not just talking about the financial pain, but to clear out that house and actually get a hold of the things that really mattered, the memories that really mattered to us and the family, as opposed to the old Christmas cards from 7 years ago. If we had it to do over again, we would be looking for help. The kind of help that you provide is the kind of help my family needed.
The issue of adult children being hundreds or thousands of miles away from mom or dad is very real, and it just exacerbates the already stressful situation. So thank you for sharing that. I've got completely different. It's going to be my last question. And I don't know if you can answer this one, but I'm going to ask it anyway. What's your point of view, all-time, lifetime Yankee fan, on a 60-game baseball season?
I'll be amazed if they get to play 10 games, because look, very unfortunately, this COVID is all over the place. And I don't know what happens. You're in a dugout and somebody just is tested positive. Well, that guy's not going to play, but everybody else that he touched that day, or was anybody, did he play catch? Who did he play catch with? Well, you can't play. You got to go get quarantined. You touch the same baseball. I mean, I just don't understand how it's going to work.
Boy, fascinating perspective on that. And let's hope it doesn't come true, but we are very certainly in sort of really interesting and unique times. Thanks so much, Frank Lalli, for joining us today. Frank Lalli, the healthcare detective. One last word from you on where people can find your program so that they can listen to all the great work that you do with NPR's Robin Hood Radio.
Just go to Robin Hood Radio on Demand. Just punch it in, and then there's a little box up in the right hand corner, and you just start to type my name, Frank Lalli. It'll pop up, and it'll take you to everything I've done for the last 10 years.
Really terrific stuff. Frank Lalli, the healthcare detective, thanks so much for joining us for this week's edition of AgeWise. And for all the team here at Silver Solutions, thank you for joining us. And remember, if you or a family member are growing older and need help with making a home safer and more senior-friendly, or you need support with a move to assisted living or to a smaller, more suitable space, or even cleaning out a space after a move or the loss of a loved one, call us at Silver Solutions. It's 1-877-AGE-SAFE, or visit us online now at silversolutions.com. Until next time, I'm Dan Lagani.